Welcome back to Mid Morning. What if a new smile could symbolize a new life? Smiles for Recovery is doing just that.
Justin Lowry and Mary Helen Shashy join us now to share more. Thank you both so much for being here with us today.
Thank you for having us.
Yes, thank you.
How was this program started?
Yeah, so in April of 2023, I started to notice a problem. So I got sober in 2021 and really noticed a lot of problems in the rooms with people that weren't smiling, looking at you in the eye, or maybe they were in pain. And you know, I've been in the dental industry for 11 years. And I went to one of my closest friends in the dental industry, Dr. Pryor, and I said, hey, how can we help? So out of that, we started training doctors, dentists all over Tennessee that would come and learn how to place their very first implant. And then we would graduate them to doing full arch surgeries over the next 2 years. That means that we take all their teeth out, put in 8 to 10 implants, and then give them a new smile all in one day.
Tell us how your organization, Grin Grant, got involved.
Well, our program, we started in 2021. I'm also in recovery. I do not have a background. I'm one of those people that says, hey, how hard can it be?
Figured out, yeah.
It's hard. So we provide the recovery support for a dental restoration for people in recovery. It's a different animal. It's not your typical client that is, first of all, they're terrified of the dentist.
Yeah.
They've been living with oral damage.
Yeah.
Our modern day leper, quite frankly.
Yeah.
Right.
And think about it in those terms. Think about it, we were speaking just outside about not engaging in your children's lives because you don't want people to judge your children based on how you look. Having to go in front of a judge and explain that you've gotten your life back together when your mouth is wrecked. So I get teary when I think, because I love. So we would contract dentists to provide smile restorations. We were doing partials and full plates and other comprehensive. But what we have learned since is that is like putting a Band-Aid on a gunshot wound.
Yeah.
These are master implant instructors. So we got together because I said, you know what, this is what needs to happen. We talked to our board and our donors, and they agreed. And they're just wonderful people. We found we started each of us started our programs with the same motive. Like somebody's got to do something.
Yeah.
How much would this normally cost, a process like that?
Oh.
So typically our cases, like if you were to purchase this case on the street, it'd be about $70,000 by the end of the, so we've done about $6.5 million in free smiles.
So if people want to help out, smilesforrecovery.org, that's the best way for people to
and we've
get involved.
never charged a patient a single dime. All of this has been free. We vetted them. There's 3 rules. All right, you got to be sober for a year to receive a full arch. You've got to have a sponsor, and you cannot smoke anymore.
That's the way to start a new
Nicotine
life,
cannot go back into your body. So we have to reteach them life skills. We have to help them on oral education. And really the problem that we're solving is relapse and death.
Yes.
All right, well, thank you all so much for coming in and talking to us.
I do want to say one last thing. I want to thank the Opioid Abatement Commission of Kentucky, who's been a big supporter of ours. Also, Delta Dental of Kentucky, they went to bat. Yes, and Healthy Foundation of Kentucky as well. We've got a lot of friends
A lot of people want to help out.
Yes, yes.
Thank you so much for being here today.
Thank you.